Understanding the immediate steps to take in an emergency, such as what to do if a child swallows a button battery, can save lives. Battery ingestion is a serious medical concern that affects individuals of all ages, particularly young children and individuals with certain conditions like autism. With the increasing prevalence of batteries in everyday devices, understanding the risks and appropriate responses to battery ingestion is crucial for preventing severe injuries and complications. This medical toxicology video will delve into the various aspects of battery ingestion, including the types of batteries commonly ingested, the symptoms of exposure, the immediate actions required, and the long-term health implications. By the end of this post, you will be well equipped with the knowledge needed to handle such emergencies effectively. Batteries are ubiquitous in modern life, powering everything from remote controls to children's toys. However, their small size and appealing appearance make them particularly dangerous when swallowed. Battery safety for children is crucial, especially as button batteries pose a significant threat due to their ability to cause rapid and severe tissue damage. According to the National Capital Poison Center, over 3,500 cases of button battery ingestion are reported annually in the United States alone, with severe injuries occurring in many of these cases. This highlights the importance of public awareness and education on the dangers of battery ingestion and the necessary steps to take in the event of an incident. Statistics and incidence of battery ingestion. Battery ingestion, particularly involving button batteries, is a significant health concern in the United States. According to the National Capital Poison Center, more than 3,500 cases of button battery ingestion are reported annually. This alarming statistic highlights the prevalence of this issue, especially among young children. Supporting this, a study published in the journal Pediatrics in 2012 revealed that from 1990 to 2009, there were approximately 65,788 battery-related emergency department visits for children under 18 years old. This data underscores the widespread nature of household battery hazards over the past few decades. Demographics of battery ingestion incidents. The demographic data indicates that the majority of battery ingestion cases involve young children, particularly those under the age of 5. Within this age group, children aged 1 to 3 years old are at the highest risk due to their natural curiosity and tendency to put objects in their mouths. Furthermore, boys are slightly more likely than girls to ingest batteries, which aligns with general patterns of exploratory behavior seen in young children. Common types of ingested batteries. When examining the types of batteries most commonly ingested, button batteries emerge as the predominant culprits. These small, round batteries are frequently used in everyday items such as hearing aids, remote controls, and toys, making them easily accessible to children. Among button batteries, the 20mm lithium coin cell battery is particularly concerning. Its larger size and higher voltage increase the risk of severe injury if ingested. Health outcomes and complications of battery ingestion. The outcomes and complications from battery ingestion can be severe. Approximately 12% of button battery ingestion cases result in serious injuries. These injuries can include esophageal perforation, tracheoesophageal fistula, and vocal cord paralysis, all of which require urgent medical intervention. While fatalities are rare, they do occur. A study published in the Journal of the American Medical Association identified 13 deaths in children due to button battery ingestion from 1977 to 2009. This statistic, though small in number, emphasizes the potentially fatal consequences of such incidents. Trends in battery ingestion cases over time. Trends indicate that the incidence of button battery ingestion has been on the rise, particularly with the increasing use of lithium coin cell batteries in various household devices. This rise correlates with a notable increase in severe outcomes, including major injuries and fatalities, over the past decade. The growing prevalence of these batteries in common items underscores the need for heightened awareness and preventive measures to protect vulnerable populations, especially young children. Risks associated with different types of batteries. Button batteries, also known as coin batteries, are small, round batteries commonly found in watches, hearing aids, toys, and remote controls. Due to their size and shape, they are easily swallowed, particularly by young children. When ingested, button batteries can lodge in the esophagus and create an electrical current, leading to rapid tissue damage and chemical burns. According to the National Poison Data System, button batteries cause significant harm within just 2 hours of ingestion. Recognizing symptoms and taking immediate action. The symptoms of battery ingestion can vary depending on the type and size of the battery, as well as the location of the battery in the gastrointestinal tract. Common symptoms include pain in the mouth, throat, chest, or abdomen, difficulty swallowing or breathing, drooling and vomiting, fever and lethargy, and gastrointestinal bleeding. Critical medical interventions for battery ingestion. Once at the hospital, medical professionals may perform the following interventions: X-rays, to locate the battery and assess any potential damage; endoscopy, to remove the battery if it is lodged in the esophagus or stomach; and in severe cases, surgery may be necessary to repair any damage caused by the battery. Long-term health complications from battery ingestion can be quite severe. Potential complications of ingested batteries include, well, several serious conditions. Battery ingestion can lead to esophageal perforation, which is essentially a tear in the esophagus. This tear can pave the way for infection and other complications. Another potential issue is tracheoesophageal fistula, an abnormal connection between the trachea and the esophagus. There's also the risk of stricture formation, a narrowing of the esophagus due to scar tissue. And let's not forget about heavy metal poisoning. The contents of the battery can cause systemic toxicity, which is honestly very dangerous. Preventive measures for battery ingestion involve several strategies, particularly in homes with young children or vulnerable individuals. Ensure that battery compartments on all devices are secure and require a tool to open. Keep spare batteries out of reach of children and in a locked container. Teach children about the dangers of batteries and why they should never be put in the mouth. Regularly inspect toys and devices to ensure batteries are securely in place and not damaged. Button battery ingestion is a serious medical emergency that requires immediate action. Here's a step-by-step guide on what to do if a child swallows a button battery. Do not induce vomiting. Inducing vomiting can cause the battery to get lodged in the esophagus or cause further damage to the mouth, throat, and esophagus. Keep the child calm and prevent any attempts to induce vomiting. Avoid giving food or drink. Ingesting food or drink can increase the risk of the battery causing more harm by generating an electric current and causing burns. Do not give the child any food or drink until advised by a medical professional. Seek immediate medical attention. Time is critical as button batteries can cause severe tissue damage within hours. Go to the nearest emergency room or urgent care facility immediately. Inform the medical staff that the child has ingested a button battery. Contact poison control. Poison control centers can provide specific instructions and support while you are on your way to the hospital. In the United States, call the National Poison Control Center at 1-800-222-1222. Be prepared to provide information about the type of battery, if known, and the time of ingestion. Stay calm. Keeping calm helps you to act quickly and efficiently. Provide information. When you reach the hospital, provide as much information as possible, including the type of battery and when it was ingested. Follow medical advice. Follow all instructions given by medical professionals. They may need to perform X-rays, endoscopy, or surgery depending on the battery's location and any potential damage. Do not wait for symptoms to appear before seeking medical attention. Button batteries can cause internal burns and severe damage quickly, so immediate action is crucial. By taking these steps, you can help ensure that the child receives the urgent medical care needed to prevent serious complications from button battery ingestion. Battery ingestion is a serious medical emergency that requires immediate attention and action. Understanding the types of batteries, recognizing the symptoms of ingestion, and knowing the appropriate steps to take can save lives and prevent severe injuries. As batteries become increasingly integrated into our daily lives, raising awareness and implementing preventive measures is essential to protect vulnerable individuals, particularly children. Following the guidelines outlined in this video, you can be better prepared to handle battery ingestion incidents and take swift, effective action. Remember, the key to preventing severe complications is prompt medical intervention and education on the dangers of battery ingestion. Will battery acid from an AA battery melt through a smartphone screen? No. The acid in AA batteries, typically potassium hydroxide or other alkaline substances, will not melt through a smartphone screen. However, it can cause significant damage to the screen and internal components if it leaks. Should you bring your autistic 10-year-old son to the hospital after some bullies at school convinced him to swallow an entire 8-pack of AA batteries, or just wait for the batteries to pass naturally? Immediately take your son to the emergency room. Swallowing multiple batteries is a medical emergency due to the risk of internal burns, leakage of corrosive substances, and potential blockage or perforation of the gastrointestinal tract. What would happen if someone chewed a battery? Chewing a battery can cause it to leak or rupture, releasing harmful chemicals that can cause burns to the mouth, esophagus, and stomach. The battery's contents are highly caustic and can cause serious injury, requiring immediate medical attention. My friend swallowed a watch battery by mistake. What could happen to her, and what should she be worried about and not worry about? Swallowing a button battery is dangerous because it can lodge in the esophagus and cause tissue burns rapidly. Immediate medical evaluation is necessary to locate the battery and potentially remove it to prevent severe injury or complications. What is the best way to get rid of swallowed button batteries or other small objects that have been accidentally ingested? Do not attempt to induce vomiting or give any food or drink. Seek immediate medical attention. Button batteries in particular can cause significant damage and need to be removed as soon as possible under medical supervision. What are the dangers of chewing on batteries, and what are some signs of poisoning if there is battery acid ingestion? Dangers include chemical burns, tissue damage, and poisoning from heavy metals. Signs of battery acid ingestion include mouth and throat pain, difficulty swallowing, drooling, vomiting, and abdominal pain. What are the dangers of an infant swallowing a coin or button battery? What are the symptoms of swallowing these things, and what should be done immediately after ingestion? Button batteries are particularly dangerous and can cause rapid burns in the esophagus. Symptoms include drooling, vomiting, chest pain, and difficulty swallowing. Immediate medical attention is required to locate and potentially remove the object. What are the symptoms if I eat battery acid? Symptoms include severe pain in the mouth, throat, and stomach, difficulty swallowing, drooling, vomiting, and potential gastrointestinal perforation. Immediate medical attention is required. What should you do if you swallow a AAA battery? Immediate medical attention is required. Swallowing any battery can cause serious internal injuries, including chemical burns and potential perforation of the gastrointestinal tract. What should you do if a child swallows a button battery? Immediate medical evaluation is necessary to locate and potentially remove the battery to prevent severe injury or complications. How dangerous is a lithium-ion battery acid if it gets on your hand and you didn't wash it off, or if a tiny bit is ingested? Are there any brain damage chances? Lithium-ion battery contents can cause burns to the skin and mucous membranes. Washing off the acid immediately is crucial. Ingestion can cause severe burns and toxicity. Brain damage is unlikely unless there is significant ingestion and subsequent systemic toxicity. How would the contents of nickel-lithium batteries affect a person if ingested or if absorbed through the skin? The contents are highly toxic and can cause severe chemical burns and heavy metal poisoning. Immediate medical attention is necessary if ingested. How many milligrams of lithium are in batteries, and what is dangerous about ingesting it? The amount varies, but ingestion of lithium can cause severe burns, systemic toxicity, and potentially life-threatening complications. Do cordless phone batteries pose any health risks to humans or animals if they are ingested? Yes, they pose similar risks as other batteries, including chemical burns and heavy metal poisoning. Immediate medical attention is required. What effects does the black powder of nickel-lithium battery have on a human if ingested or when comes in contact with skin? The black powder typically contains toxic heavy metals that can cause chemical burns and systemic toxicity. Immediate medical attention is required if ingested. Is the white stuff that sometimes comes out of alkaline batteries dangerous? What happens if it comes into contact with one's teeth, or is ingested or gets in one's eyes? The white substance is usually potassium hydroxide or other caustic chemicals. It can cause burns to skin, eyes, and mucous membranes. If ingested or comes into contact with the eyes, rinse immediately with water and seek medical attention. What happens if you ingest the oil from an AA battery? Several years ago, at least 5 years, I licked a tiny amount of oil from an AA battery. Is that bad? Do I need to see a doctor? A tiny amount likely caused minor harm, but ingestion of larger amounts can cause severe burns and toxicity. If symptoms occur, seek medical attention. What percentage of battery ingestions pose a risk of significant harm? Significant harm can occur in a high percentage of cases, especially with button batteries in children. Exact percentages depend on the type and size of the battery and the individual's age and health status. I ingested battery corrosion. Should I be worried about lead poisoning? Yes, battery corrosion can contain lead and other toxic substances. Immediate medical evaluation is necessary. I ingested a small amount of battery acid. What should I do? Immediate medical attention is required. Battery acid can cause severe burns and systemic toxicity. How do button batteries do so much damage if ingested? Button batteries can create an electric current when they come into contact with bodily fluids, leading to rapid and severe burns in the esophagus or gastrointestinal tract. What is the healthiest type of battery to ingest? No batteries are safe to ingest. All pose significant health risks. I accidentally dropped my AA battery and the back cover from my Xbox controller into my water and immediately pulled it out. I forgot it was in there later and drank the water. Is there a possibility I ingested battery acid? If the battery was intact, the risk is low. However, if there was leakage, seek medical advice to rule out any harm. How dangerous is dry corrosion from batteries if a small amount is ingested? Dry corrosion can still cause chemical burns and potential toxicity. Medical advice is recommended. I was handling an 8A battery and it was sticky. It had no sign of corrosion. Is this a leaking battery? If so, what would happen if I ingested it? It might be leaking. Ingestion of leaked contents can cause burns and toxicity. Seek medical attention immediately. What are the steps that should be taken when a child ingested a button battery? Immediate medical evaluation is necessary to locate and potentially remove the battery to prevent severe injury or complications. How quickly will the symptoms of battery acid ingestion occur? Symptoms such as pain, burning sensation, and difficulty swallowing can occur almost immediately after ingestion due to the caustic nature of the acid. Seek medical attention immediately. Should poison control be contacted if a child ingests the crystallized crust on the surface of an old battery? Yes, contact poison control immediately. The crust is likely potassium hydroxide or another caustic substance and can cause burns and toxicity if ingested. By being informed and prepared, you can ensure the safety of yourself and your loved ones in the event of battery ingestion.